procedure itself, and then we'll go from there.
Okay. Yes, hello. My procedure that we do here is a stem cell. It's adult adipose, so it comes from your own fat tissue, no one else. The fat tissue is harvested from the lower abdomen area in a mild liposuction procedure, done under local sedation, so they're not put out for it. It takes only about 15 minutes, so they're talking to us the whole time. Once we've extracted the stem cells that we need, we have to process. So during that time, they have a little bit of downtime, kind of waiting. We put them in a private room where they're watching TV, listening to music, talking with their family, and it takes us a little bit of time. Once we get it prepped and prepared, we bring it back into the room, and it is deployed depending on their condition, whether it's injection or IV, or it could be both injection and IV, which is determined by the doctor.
Okay, now tell me what would get them to that point. Tell me the conditions. Under what conditions would you need stem cell treatments?
Treatment. Generally, there's a lot of joint pain. Knees are the biggest treatment for stem cells around the world. Once the stem cells are prepared, they're injected under ultrasound guidance by an orthopedic surgeon directly into their knee cavity. Also, we do IV deployment as well, so it goes through their bloodstream and attacks it 2 different ways. Their MS is a big treatable disorder with stem cells, also COPD, and a host of other issues that we've seen. A lot of autoimmune issues respond very well as to date as well.
Okay, so tell me what kinds of symptoms they have had, and then what's been different since the stem cell.
Kind of quite a variety. Mainly for the knee patients, it's obvious. It's that everyday pain that they have to deal with from walking around, from their everyday life, going up and down stairs. And they get some relief from the pain, the swelling. It has more of a cushion for their walk so they can do their everyday activities, the things that we kind of all take for granted. A lot of the MS patients, they can have some mobility issues with their legs, being able to bring them up, making it harder for them to dress. Sometimes patients will have issues with nerve pain as well, which can be pretty debilitating. It can be pretty painful, can affect a large portion of their life, and they can get some relief from that. Relief can occur pretty quickly, sometimes as soon as 1 day, but for most patients, it's about 4 to 6 months that they really get a big change in their symptoms.
So tell me, tell me as just a viewer, what actually happens when there's the healing that goes in, when the stem cells start to, when the healing is occurring, and what's happening?
Okay. When the stem cells are deployed into the body, first they start to attack a lot of the it's more anti-inflammatory effect, a lot of the inflammation, and that does trigger a lot of their pain as well. It generally takes about 4 to 6 months before the cells start to replicate and cause a little more healing, so they can have benefits that keep growing. Some patients, depending on their conditions, may choose to have even multiple sessions down the road, whether they want to get even more better than what they are now, or they want to prolong the symptoms from coming back. So it's been a big change in their lives. It's been huge.
Tell me how successful it's been from what you've seen. What your take is on this?
Well, from what my take is, of course, first things first, we have to see them in for an evaluation. It's a very thorough evaluation. We want to make sure there's a very high probability for success, or we will not do the procedure. Also, with our percentage rates from the treatments that we do here, I would have to say our success rate is approximately around 90% of a positive result. And that's because we go through such a thorough evaluation. We want to know pretty sure that they're going to get a good response.
Mm-hmm. Mm-hmm. So tell me about your feeling about you helping these people. How does it make you feel?
Oh, it's the greatest thing in the world. It's fantastic because we really get to spend time with these people. We really get to know them. We're part of their lives. A lot of them come to this decision not very lightly. They've been through a lot. They've gone to different doctors, different approaches, whether it's holistic, whether it's more medical, whether it's dietary changes. They've gone through a lot before they've gotten here. And a lot of these people, it's kind of like a last hope for them. And they're very well informed. By the time they get to this state, they know a lot about what they're in for and what their chances are for success. So it's great to kind of walk through that journey with them, kind of hold their hands and say, we're here with you and we understand, and we're going to do everything within our power to make sure that we can make this good for you.
Perfect. Okay, tell me about the individual stories that you wrote about here with specifically Sarah.
Yes. Oh, Sarah's my favorite. Sarah came to us and she was an MS patient. She also had very debilitating nerve pain in her face, which made her life very difficult. Just brushing her teeth was excruciating pain. Applying makeup was something that was very difficult to do. It affected not only her personal life, but her work life as well, because that pain was constant. It was always there.